Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the reports from the world of medicine. Certain snacks help reduce the LDL cholesterols. Snacking can be healthy too. How? Let's find out. For decades now, snacks and their habits are very considered unhealthy, and people with high levels of cholesterol are often advised to cut down on their snacking habits and eat healthy boiled vegetables and fruits. Now, often medications for cholesterol aren't followed, making the management of cholesterol a very serious trouble as it is the root cause of developing cardiovascular and kidney diseases. Now, the Journal of Nutrition brought out a very interesting trial that had a different approach to manage the LDL levels in patients who refused to take the statin therapy. A pleasure, loved and acceptable snack-based solution formulated from cholesterol-lowering food ingredients could represent a therapeutic alternative for lowering the cholesterol. LDL cholesterol was found to be reduced by 9% approximately, and total cholesterol reduced by 6%. A combination of cholesterol-lowering bioactive compounds can definitely and rapidly meaningfully reduce the LDL cholesterol on adult patients unable or unwilling to take the statin drugs. Tadasana yoga to help in vasovagal syncope recurrences. Yoga with an ancient history of its roots can be traced back to over 5,000 years ago in India. Vasovagal syncope, on the other hand, is found in all the age groups, and yet there is no proper effective treatment for this particular condition. Now, Tadasana, or the mountain pose as we all know it, is a basic of standing posture that metabolically enhances the body's function and heart health. A recent study in the JACC Clinical Electrophysiology reported 3 major findings about this particular posture with relevance to syncope. The first one being the conventional therapy that benefited patients with symptoms. Secondly, it caused very fewer recurrences in patients. And thirdly, the Tadasana posture, that is the mountain pose, was well tolerated with no adverse events. The study concluded that the Tadasana pose increases the venous return and often lowers the limb muscle tone, stabilizing breathing, helping the autotonic tone. Eating dinner close to bedtime may disturb the blood sugar control. Blood sugar control, which is impaired in individuals with diabetes, is affected by various factors including the timing of meals relative to sleep as well as the levels of melatonin, a hormone primarily released at night that helps control the sleep-wake cycles. In a research published in Diabetes Care, eating dinner close to bedtime when the melatonin levels are high disturbs the blood sugar control. The high melatonin levels and the food intake associated with late eating impairs the blood sugar control through a defect in insulin secretion. The authors noted that for the general population, it may be advisable to abstain from eating for at least a couple of hours before bedtime. A robot performing the first laparoscopic surgery without any human help. We are into the 21st century and the technology has grown way beyond expectations, and its use in the field of medicine has brought greater results and advancements in specifically diagnosis and treatment. A robot performing surgery, quite an unusual episode, right? But it is true, a robot has been seen performing a laparoscopic surgery on the soft tissue of a pig without the guiding hand of a human, a significant step in robotics towards fully automated surgery in humans. The robot excelled at intestinal anastomosis. Connecting two ends of an intestine is arguably the most challenging step in gastrointestinal surgery, requiring very precision in suture with high accuracy and consistency. Even the slightest of the hand tremor or a misplaced stitch can result in a leak that could have catastrophic complications for the patient. The robotic anastomosis is one way to ensure that surgical tasks that require very high precision and repeatability that can be performed with more accuracy and precision at every patient independent of any surgical skill. Intense walking may reduce the type 2 diabetes among 65 years and older. Diabetes has become the most common disease in people specifically aged 40 to 70 years. Changes in lifestyle, eating habits, and many other factors influence the complications of diabetes as such. According to the American Diabetes Association, 1.5 million people are diagnosed with diabetes every year. A multi-institutional team of researchers analyzed data from the Women's Health Initiative, whose aim was characterizing the physical activity and cardiovascular health in post-menopausal women. Walking regularly and at greater intensity may help prevent type 2 diabetes among 70 and 80-year-olds, according to one of the first studies measuring steps and pace among this particular population. The more steps a person takes and the more intense the walking is, the lower is their risk for developing diabetes, a report published in the issue of Diabetes Care suggests. Hence, it is important, even if you have slaved off diabetes, to keep with it and to incorporate regular stepping as a part of your daily schedule and make it a proper routine. So step away. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.